Hi, this is Kim McAllister, and we're going to talk about the nursing diagnosis or community nursing diagnosis. And the community nursing diagnosis is used by community nurses to help us figure out what we're going to do, how we're going to do it, what the potential issues are, and how we're going to prioritize what we do. So you may remember the nursing process, and we have the assessment, diagnosis, implementation, and so forth, just like your regular nursing diagnosis in an acute setting. So with the assessment in community, we're looking at a community, not an individual person. So we're going out and we're doing assessments. When you did your windshield survey, that was an assessment. When you looked at your demographic data in Sentinel City, that was part of your assessment. When you talked with your key informants in the community, the people with the yellow boxes on their head. By the way, people in the real world don't have yellow boxes, just in case you wanted to know. So when you're talking with them, all that information is part of your assessment. So after we've done all that, then we're here where we want to diagnose and do a community nursing diagnosis. And then we're going to figure out what we're going to do based on that. So when we do the demographic assessment, as I mentioned, the first thing that we do is we go to census.gov, because this is where all the information that they collect from the census ends up. And go to American Fact Finder, and then you just type in your city. See, here's Cordell, and boom. Oh, that's education. Well, boom, here. This is your population. So it'll tell you how many people are in your community. And then you can go through all these boxes and find out all kinds of cool stuff. Like here's your population by age, and here's the male population by age, and the female population by age, and race, the population by race, different races and different ethnic groups. And then you look at relationships. Who's in your house? Is it just you? Is it a spouse? Do you have children? Are they relatives? Are they relatives under 18 or over 65? Household types, household occupancy. All of that is right there in one big convenient table. So then you can go to industry and you can look at all the different populations and who all's in them. How many male, how many female. And the reason this is really helpful is if the issue that you're looking at is something related to an industrial type thing and to a work related problem, you can look here and look at the people that are in them. Let's just say it's an issue with hepatitis A from food preparation workers. You can look here and see okay, our total population is this. So we know we're going to be gearing up and getting ready to interview 593 people potentially. So this is how we can use this information. And then you can go back and you can get information on education. So you can look at all the educational attainment in the community and do it by both sexes and then by male and female. You can also look at housing. You can look at income. Like here is the income in the last 12 months. This is in 2016. If you go, the census is done every 10 years, but there are updates where they'll send out and get information to update it. And you can see the employment status, who all is employed, who commutes, who walked, who took public transportation, what the different, your occupations, your industries, your class of worker, what the median income is for the area. Here's the median income in Kerrville, it's $40,000. And then you go on down and look at the other information. And what's really nice is you can also get poverty information. So you can look at what the poverty levels are. And we particularly want to look at children in poverty. And we want to look at also female head of households who are in poverty. Because not that men are not important, they are. It's just that in general, we find that women who are single household holders and have children and everyone's in poverty, they have a lot of problems, a lot of risk, and a lot of health problems. Anyway, you can go through all the different tables there and get all kinds of information. You can go to your State Department, State Health Department website. For Texas, it's the Department of State Health Services, and you can find all kinds of information on different illnesses and death and other problems. And then you can go here and look at the vital statistics. You can look at the summary of birth and death. You can look at the births. You can look at pregnancies. You can look at deaths by region, county, and so forth. And you can look at it by race, infant, neonatal, fetal, and perinatal deaths, all kinds of information on that. And you can also find the leading causes of death for your state and so that helps you kind of compare where your community is with the state. And then you can go to CDC and get all this information at the national level. So I'm not going to go into any more of that. So our traditional nursing diagnosis, the NANDA, is focused on the individual. This one person that you're taking care of, you do all of the nursing process and you create a plan of care for that person. And the community is our patient, and so we've got to design this at a community level. And so our community nursing diagnosis is focused on the community, and we look at different the nursing outcome classifications, and we can use the Omaha system to look at that. Just go to omahasystem.org and you can take a look at that. So why do I need to do this? Well, you need to do this now because this is part of your assignment. But we do this as community nurses because we need to clarify what the problem is, and we can't start helping until we know what the problem is. And so this is going to identify who should receive care and the problems that are being faced by those receiving care and the things that are contributing to the problems. And so our format is going to be risk of something or actual. So it could be risk of diabetes or risk of other issues. Anyway, it's going to be among, that's going to be the population that we're working on, and then related to, what's the reason why this is happening? And then it's as demonstrated by or as evidenced by. So what is our data? What did we find out in our assessment that tells us this? And so the risk of, or the actual, is a specific problem or health risk. Don't just put down that the people in this community have poor health. Okay, that doesn't give us anything we can work on. We need to know specifics. What kind of problem? What's the problem you're focusing on? There may be 15, 20, 30, 40, 50 problems in the community, but let's talk specifically about one problem that we're going to take care of. And then the specific community client. Is it everybody in Kerrville? Or is it the teen girls at Tybee High School? Is it the senior adults in Florida? You've got to nail down a specific community, a specific group, and you need to state what makes that specificity of the client. And then it's related to, what are the characteristics in the community? And you get all of this from your assessment data. And so you're going to compare the epidemiological data. That's all the stuff that we looked at on the state website, and then also the demographic data that we look at on the census site, and then compare all of that at a state and a national and a regional area. So you're going to look at that. Is this just a problem in this community? Is this just a problem in our state, or is this a nationwide problem? Because then we got a bigger problem. So we need to look at what's going on. And then we look at our survey data. So here is an example of a community nursing diagnosis. This is increased risk of type 2 diabetes among residents in census tract 1517. A census tract, by the way, is a subset of a zip code. You do not need to worry about your census tract. You can focus on your zip code. related to lack of health education, fatalistic attitude of residents, and a social environment that encourages unhealthy lifestyle habits, as evidenced by type 2 diabetes as the third leading cause of death for the census tract. Statements from key informants regarding type 2 diabetes as inevitable, and inadequate health care within the borders, and lack of healthy food options within the census tract. So you have your problem, and you have your specific population, and so forth. And we're going to break this down. So the risk is the increased risk of type 2 diabetes. So we're looking at the people that don't have it yet. So there's an increased risk of people in this community to have diabetes, type 2 diabetes. And it's among the residents in census tract 1517. So here's your specific group of people. And it's related to a lack of health education, the fatalistic attitudes of residents, a social environment that encourages unhealthy lifestyle habits. And it's demonstrated by the fact that it's the third leading cause of death for the census tract, statements from key informants regarding type 2 diabetes as inevitable. Everybody in this community has it. I know I'm going to get it, and I can't do anything about it. Inadequate health care within the borders, that's the borders of the community, and lack of healthy food options within the census tract. So your community diagnosis may include current health needs. There's a need for health education. There's a need for diabetes education. There's a need for asthma education. There's a need for whatever type of issue that there is. Positive or negative community dynamics, like the negative community dynamics in the nursing diagnosis were that people saw diabetes as inevitable, and there weren't any options for getting healthy food. What kind of gaps are there in healthcare delivery? So that could be part of your problem there. Description of the problem or the issue or the human response to health. You're going to synthesize your community assessment data, your nursing knowledge, and your epidemiological concept of risk. So what are we at risk for? So the community diagnosis have to include the responses of the community to experienced and possible illnesses and other health threats. So how have they responded to it? And it has to be defined. The community nursing diagnosis has to be defined in observable and measurable criteria. You've got to state what's going on and what the problem is in a way that we can address it. And then the diagnosis must describe a problem that nursing can solve through nursing intervention. It's got to be something that we can act upon. So you want to make sure that whatever you pick is something nursing can do something about, because there are other problems that need to be addressed, and those can be referred to other disciplines or other agencies. But we're looking at what can we do as nurses about this problem. Well, I hope this is helping you get some clarity on how to do that. Please let me know if you have any questions.